www.healthcmi.com. Acupuncture Continuing Education Online, Health CMI. Today, acupuncture for shoulder pain. I wanted to talk a little bit about this because there's simply a very large amount of research showing that acupuncture is both safe and effective for the treatment of many types of shoulder pain. Now, when I refer to the shoulder, I'm specifically referring to things like the rotator cuff, of course, the scapular blade on the back, and pain that tends to radiate through the neck and down through the arm. Because we use shoulder as a general term, but that could be everything from the scapula to the clavicle to the humerus, that whole region on the side of the body. Now, there can be range of motion problems where people can't lift the arm or bend it in certain directions. There can be pain. There can be difficulty sleeping due to pain. A lot of problems, including frozen shoulder, which is really a generic catch-all term, sometimes even called adhesive capsulitis, when there's a lot of problems with the range of motion movement, sometimes bursitis, a whole lot of disorders that often work together to immobilize the shoulder. People can't even brush their hair. They can't take their shirt on or off correctly. Or let's say they're a professional athlete, difficulty with sports. A whole lot of problems can happen with the rotator cuff and shoulder, including when you're trying to sleep. And if you rest on it, you turn from side to side, it can wake you up and then causes all kinds of problems with insomnia. So we could go on like that, kind of describing some of the scenarios. But let's get back to acupuncture and what can it really do? Is it just for the pain? No, it's not limited to just the pain. And I'll get to some of the research in just a moment. Yes, acupuncture can reduce the frequency and intensity and duration of pain associated with shoulder pain and dysfunction and frozen shoulder, but it also can improve range of motion. In other words, it can restore the health to the tissue, including the soft tissue, reduce inflammation, including reducing bursitis, and in the case of adhesive capsulitis, some of the tissue can resorb and break up and resorb on its own. Now, in the most severe cases, and these are people where there's so many adhesions, think of it like cobwebs in the rotator cuff, that the tissue just builds up and binds that rotator cuff and locks it solid. Body grows tissue there and locks it up. It won't let it move. In the most severe cases, an orthopedic surgeon may put someone under general anesthesia and rotate their arm through the range of motion to break up those adhesions. And that can be very effective. Now, that's a more extreme scenario for frozen shoulder. And I would say, if I was in an acupuncture clinic seeing dozens and dozens of these cases a year, maybe one would need to be referred out, because it does get to the point where sometimes it's completely locked up and the tissue has just frozen that shoulder in place. That does occur. In those cases, those orthopedic techniques can be very helpful, but most people don't need that. Most people also don't need to be put on all kinds of anti-inflammatory drugs and things like that. That's not really going towards healing the tissue. So what the research is showing us is that acupuncture can heal the tissue, reduce the inflammation, and as a result, there's less pain, less inflammation, and better range of motion. In other words, acupuncture isn't just covering up the problem, it's going to the root and healing it. Now, naturally, lifestyle choices are very important. If someone has poor posture, if someone is doing something, let's say typing on a keyboard and throwing the shoulders forward or sleeping on the shoulder every night, that one shoulder, that can cause constant re-injury with repetitive motion. And there can also be unhealed physical injury. The acupuncture can address those things, but again, the lifestyle has to adapt so that we're not constantly causing the problem itself as well. That is also important to mention, that as good as the acupuncture can be, there are lifestyle changes that may need to occur. Or certain types of exercises, for example, that people need to engage in. They may be doing maybe certain types of motion in their bar class or yoga class or qigong class or tai chi chuan class. which can be very helpful in maintaining that repair. So the most recent research at healthcmi.com I'm looking at right now shows that acupuncture, very simple treatment, local points, restored for rotator cuff injury patients, range of motion and reduced pain. And they use, the UCLA shoulder rating scale, and they use the shoulder pain and disability index and the range of motion for shoulder index to measure the results. And they also, Meiji University in Japan, they also did some research very similar to that. And they also discovered in that research that acupuncture combined with physical therapy is significantly more effective than physical therapy monotherapy. So again, combining therapies can also be very helpful. And that's not unusual. In Chinese medicine, we may use what we call Tui-Na massage or certain range of motion exercises in combination with acupuncture. In the United States here, a lot of people combine physical therapy with the acupuncture. But if one just gets physical therapy alone, results can be limited. But once you combine that with acupuncture, you're going to get much better results. Most of my patients don't get to the point where they're going to need physical therapy. Some do. And together, we usually have it in almost all cases, a good recovery, complete recovery. Again, in some very severe, rare cases, then they do need to be referred out to the doctor to be put under anesthesia and then go through the range of motion. It's not a pleasant experience if someone is conscious for that. Sometimes people are knocked out for that. But it does work when it's completely locked up. Most of the time, we can get the shoulder unlocked with simple acupuncture treatments. It's very straightforward. For acupuncturists who are listening, this particular study from Japan, the points here are large intestine 14, 15, so Binyao Jian Yu with small intestine 9, Zhan Zhen Sanjiao 14, Zhan Liao, small intestine 11, Tan Zong, and some Asha points. I would say that kind of hits on some of my favorites, really, in terms of just local points around the rotator cuff. It really does get some great areas. Doesn't cover all of them. A lot of acupuncturists that might offer something like Sanjiao 15, triple burner 15. Now that point, it's above the scapular spine, and people love it when you massage it. Immediately, they feel great. Gallbladder 20, 21, things like that, unlocking the neck. Because we do need to differentiate if it's local to the rotator cuff or is it somewhere like a brachial nerve entrapment syndrome in the brachial plexus, or maybe it's from the cervical vertebrae in a disc region, and we have to do some what we call Huatoya G points and electroacupuncture to reduce the swelling of the disc and allow the nerve fibers to relax and heal. There's a lot going on with shoulder pain. Sometimes it is caused more centrally at the disc region. So this particular research is entitled Acupuncture Found Effective for Shoulder Pain Relief. And if you go to healthcmi.com and click on news, this article was published on June 23rd, 2022. That's how you can see this particular article I'm looking at right now. So again, healthcmi.com, click on news, and then the article entitled Acupuncture Found Effective for Shoulder Pain Relief, June 23rd, 2022. And this particular research has a small sample size, and there's two pieces actually there. Not the biggest sample sizes for research, but there are many other articles there in the newsroom on the same topic with similar points showing the same type of outcomes, positive patient outcomes, with larger sample sizes. In fact, there's dozens and dozens and dozens. So any one particular study is not very impressive. It's the group over decades of research that is more impressive. I would say that at this point, based on the evidence, based on the science, it is responsible to integrate acupuncture into many types of rotator cuff syndrome, including bursitis, frozen shoulder protocols, because the research is just showing it works. It's getting the job done. Nothing really in the way of side effects, maybe a bruise here or there on some occasions, but that's about it. So we're getting the job done. People are getting better. They're getting off the drugs. They're able to go back to life and be able to comb their hair, take shirts on off. And in terms of sports enhancement for high performance people, there's a lot of rewards there. So definitely, this is everything from regaining range of motion all the way to really optimizing range of motion and strength and power to the arm. And especially when there's a pinched nerve. I remember treating a football player, and he really lost a lot of his grip strength as well because there was some disc-related material. And, when someone's bicep is as big as my torso, I should not be able to pull on their arm and outstretch it and they can't resist against it. They should be strong enough where I can't overpower them. Football players can get pretty big, right? So what happened was he had a little swelling on C5, cervical vertebrae 5 disc. And so I just needled nearby, brought the swelling down, and he had that strength. Again, he was just like an iron grip. You couldn't move that arm if you pulled on it, yanked on it, climbed on it. So he was very happy about that, went on to his successful football career, resuming that. So acupuncture has a lot of great applications in sports medicine. And we've seen that with knee pain, especially for people like basketball players and tennis players who have miraculous lateral movement, suddenly changing direction. And those people tend to need stuff for the ankles and knees more. So a little bit about that. The research is there for it. Go to healthcmi.com, click on the news department. You really like what you'll see. Again, to learn more, ask if your local licensed acupuncturist has good experience. This is their specialty. It's something they work on and are comfortable with treating you. And if you need that, just call around the local people that you get, good referrals from and see if that's what they do. Acupuncturists can specialize in many areas. Many will be able to handle this, so ask around for that. I'm Adam White, licensed acupuncturist for healthcmi.com. Thank you for listening. www.healthcmi.com.